If you are here trying to figure out if a Medicare Advantage plan fits you best, you're in the right place. The reality is, with all the commercials and the different opinions, it can be really hard to figure out if an Advantage plan is truly best for you. So in this video, I'm going to talk about one, what these plans are, and number two, how to decide if it really makes sense for you, okay? And to get more tips on Medicare, make sure you click the link below and subscribe to our channel. So here we go. You've worked hard for Medicare. Let's now get the most out of it. So Medicare Advantage is another name for Medicare Part C as in Charlie, and it's more or less privatized Medicare, okay? So when you join a Medicare Advantage plan with, say, XYZ company, right? There's all these companies that offer the plans, but let's say it's with XYZ company. If you join a Medicare Advantage plan, you are technically leaving the traditional Medicare system and you're entering into XYZ's world of Medicare, okay? The Advantage plans are required to cover all the same basic Part A and Part B services as determined by Medicare, okay? But company XYZ can set up some rules and some parameters in order for you to get care. Most of the time, Medicare Advantage plans work like an HMO or a PPO, meaning that they have rules as to which doctors you can see, how referrals work, things of that nature, okay? So again, these Advantage plans have to offer all the same basic benefits, but they can require certain requirements for you to get through in order to get that care covered, okay? So if you're in an Advantage plan at, say, Kaiser Permanente, and you try to go to Mayo Clinic does not take the Kaiser Advantage plan, okay? So it will limit the doctors that you can see on Advantage, all right? Now, Advantage plans not only have to cover the same basic Part A and Part B services, they also usually include drug coverage, which can be helpful as it kind of lumps everything together. And in addition, these Advantage plans have premiums, they have copays, and they have max out-of-pocket amounts. Now, the max out-of-pocket amount is set every single year, and as of 2022, the max out-of-pocket amount for in-network facilities is around $7,000 a year, and even higher, an even higher maximum amount if they're allowing you to see out-of-network doctors. Okay, so I think, and again, I could talk about this for hours, but Advantage plans are very different than a traditional Medicare with, say, a Medigap and a Part D plan. And most of the time, what the commercials and what the pamphlets in the mail talk about, what your friends talk about, are things like zero premiums and dental benefits and free gym memberships and extra vision coverage and maybe ride to the doctor and things of that nature. And those are all great benefits. But I don't know about you, but I think that health insurance is most important if it allows me to see the doctor that I want to see while protecting my money, right? Protecting my savings, okay? And so this leads into how to decide if Medicare Advantage is right for you, okay? And there are three things that I mainly look at for our clients to decide if Medicare Advantage is the right fit, okay? And I mentioned one of these before, but the first one is understanding, does your doctor accept Medicare? Okay. Again, I have some health issues. I have a herniated disc in my back, and I don't know about you, but when I get surgery on my back, I want to see the best doctor. And insurance won't be very good for me if the doctor that I want to see does not take it, right? And most of the clients that I work with are the exact same way, right? They have an opinion on the doctor that they want to see, and they want to be sure that their insurance will actually cover that doctor. So the first step again is around, does the doctor take Medicare Advantage? So my advice to all of you is to make a list of both the current doctors that you see, and if you see no doctors, if you were to have cancer tomorrow, let's get clear on which doctor you would want to see. And then go out to each of those doctors and or facilities and ask them what type of Medicare they accept, right? Do they accept Medicare Advantage? And if so, which specific types, okay? Most of those top research hospitals accept few to possibly even no Medicare Advantage plans. So it's really clear, it's really important to get really clear now on the type of Medicare that your doctors accept so that you can actually use it. And as a side note, Medicare has insurability rules in most states. And for that reason, when you first join Medicare Advantage, it can be really hard, if not impossible, to go back to original Medicare with a Medigap plan. So it's important to get this right the first time, okay? What I see people usually do is that they first join an Advantage plan because it sounds great with the zero premiums and all these things, and then they get sick and they realize that their doctor does not take that Advantage plan, okay? So let's get really clear up front on the doctors that you want to see and the type of Medicare that they accept, okay? That's number one. Number two is all about your medications. I have found for certain people with very expensive medications, they can have a much lower cost for medications on Medicare Advantage plans, okay? Not always, but for our clients with expensive medications, we look to see what Advantage plans will cost for their medications because it can be a determining factor, okay? So again, medications can be a driver to decide if Medicare Advantage is truly best for you. All right. And number three is all around being comfortable with the total cost of Medicare Advantage. Okay. Medicare Advantage, when you have health issues, tend to be more expensive when it comes to total out-of-pocket cost. And for that reason, if you are comfortable understanding what those, the premiums are, the copays are, the amount of max out-of-pockets are, if you're okay with that, then Medicare Advantage can also make a lot of sense for you, okay? For example, if you're on Medicaid, Medicare Advantage can make a lot of sense for you because when you're on Medicaid and Medicare, which is called dual eligible, you have a special Medicare Advantage plan that can limit what you pay to basically zero for your health care. Okay, so again, those are the main factors that I look at to decide whether Medicare Advantage is truly right or best for someone. Now, for our clients, most of our clients prefer original Medicare and not Medicare Advantage. Usually they prefer that, not always, but usually they prefer it because they have access to more doctors, it has lower costs, and we tend to have a more affluent client base, I will say, and they understand what they get for what they're giving up, okay? But whatever you do, please do not pick out an Advantage plan or any plan for that matter without following a proven process that gets you to that right decision. I get calls all the time from people who've made the wrong decision, and it's because they didn't follow the right process, okay? So as a conclusion, Medicare Advantage can fit certain people really well as long as they follow all three of those steps that they just follow, all right? That I just talked about. All right, so to learn more about Medicare, to let me help you easily get through Medicare, click the link below, subscribe to our channel. I look forward to helping you easily make your right Medicare decision.